There's a lot that we can fix with the U.S. healthcare system, but what we're seeing shows us that technology is clearly the answer. When we put HealthSnap together, we figured we could use technology to deliver evidence-based lifestyle strategies to patients to integrate with their care outside of the hospital. We also knew that we can help patients with chronic conditions manage appointments and their multiple medications and other things that could be hard even for a 30-year-old patient, not to mention an elderly patient that might be dealing with cognitive decline. Finally, we expected that the monitoring of certain physiological variables such as body weight and blood sugar and blood pressure could help identify health crises before they arrive, making healthcare more proactive. And of course, we expected this to make patients healthier and reduce their hospitalizations and their readmissions and their hospital stays, the length of stay, reducing total costs of care. We expected all that. But honestly, what we didn't anticipate was the medicinal effect of remote patient monitoring, where without any other changes to their care, hypertensive patients, thousands of hypertensive patients, are seeing a reduction of systolic pressure by over 14 points when you compare their first week of readings to their most recent week of readings. We see similar improvements in patients when it comes to their blood sugar, with severe hyperglycemic patients at baseline seeing an over 40-point improvement in fasting blood glucose, again, without any changes to their care other than being added to the program. So when we ask patients what they attribute these improvements to, they typically speak to the accountability piece. They say that knowing that their physician is able to see their data, getting feedback on their daily data, helps them remember to be accountable and to take their medications. They also say that they see the direct effects of lifestyle on their data day to day, and they're getting feedback on that. It's analogous to a marathon runner using a heart rate monitor to set their pace. But in this case, we're talking about monitoring a disease condition daily and making changes that can be life-altering.